The food literacy in this country is below poor. It's abysmal. Unless we get a hold of the root causes of healthy eating and physical activity, and to also the degree about healthy responses to stress, we will not have an affordable healthcare system. We will not have children who can become adults who can work an 8-hour shift.
Our statistics on children's health and general people's health are terrible because we have not attended to maintaining the value of whole, good food as a real value and cultural norm.
About 5 years ago, the rates of cardiovascular death started to increase. And it's due to food. It's due to obesity. It's due to type 2 diabetes. It's poor food intake of high calorie, added salt, added sugar, added fat, processed foods, excessive amount of meat and dairy products relative to any community in the world, all of which can also induce inflammation. Then finally, sedentary lifestyles. We're spending literally sometimes up to 14 hours a day in front of a computer screen.
Food, of course, is not just to nourish our body, it also nourish our mind, our soul, and is closely linked to our culture and emotions. So that's why I think we have to look at food production and the food system in a holistic way, not just to look at it as a health issue. We have to look at it as an environmental issue and an animal welfare issue.
The statistics in companion animals parallel the statistics in people. 1 in 3 dogs or cats are overweight, but that doesn't tell the entire story because that's all dogs and cats. So if you take out the growing puppies and kittens and the very old dogs and cats, it's over 50%. They're sharing our environment. They're sharing a lot of the same risk factors that we're exposed to, whatever disease we're talking about, obesity being a good example. And so this is a real opportunity to study some fundamental questions about, the risks, the causes for certain conditions, and also maybe solutions.
One Health is bringing together thought leaders in a variety of fields, from agriculture to sustainability to healthy buildings to antibiotics, and veterinary science. And this is really the uniqueness of it, this platform. And we all need, in order to create change, we need to be speaking to one another and working outside of our silos.
So I think people have conventionally sort of focused on equity thinking from a socio-economic perspective, really thinking about income levels. And so a lot of the dialogue has focused around access to farmers markets and having the income to purchase healthier local produce. And more what's emerging in terms of an equity framework, it's not just having economic access to healthier or more sustainable food choices, it's also sort of thinking about all of the cultural dimensions that are associated with that. And so in some communities where we work, household members don't actually feel culturally appropriate going to a farmer's market because that hasn't really been historically how they have purchased their food, and even the space of the farmers market doesn't feel equitable to them. And so it's not only an issue that is about economics, but it's really thinking about all of the multifaceted dimensions that create cultural identity and personal identity.
We have obesogenic environments that don't set us up for success. And so our work really is then to have our environment be supportive of our behaviors and be supportive of behavior change.
Food environments include both the natural food environment, so that's like wild resources as well as cultivated resources, and the food environment is also the built food environment, and so that may be supermarkets, farmers markets, the food we get at institutions such as cafes or in the school system or in hospitals. And the food environment eventually impacts the availability, affordability, convenience, and desirability of food, which then impacts our food choices.
The great thing about using buildings as vehicles for change is that we can address health in many passive ways. So instead of having individuals have to actively, sign up for a class or some type of healthy eating program, When we integrate passive design and invisible kind of nudges in the built environment, we have 100% participation.
Diets can't be prescriptive, and so providing recommendations that give a range of options for people to make it work for them, I think is key. One rule of thumb that I like to use is half of your plate should be some sort of green or a vegetable. And then the other half, you break it down into a quarter of starches and whole grains, and then the rest should be proteins, whether that's lentils or a small portion of meat or fish.
There are a lot of nutrition myths out there. A lot of people still fear fat. They feel that fat is something that we need to limit, when it's really the type of fat we need to be more concerned about. We want to look for unsaturated fats, canola oil, olive oil, avocados, nuts. Those are great sources of fat. They're going to help us. The trans fats, the saturated fats, we do want to shy away from those. Carbohydrates are not the enemy. Carbohydrates, complex carbohydrates like whole grains, brown rice, they give us fiber, they give us B vitamins. If we cut carbohydrates out of our diet, our body has to shift to different fuel sources and processes, which it wasn't designed to do.
One common myth is that any plant-based diets are healthy and sustainable. But we know that not all plant-based foods are created equal. I mean, there are healthy plant-based foods such as fruits and vegetables, minimally processed whole grains, nuts and legumes. On the other hand, in our obesogenic environment, most of the plant-based foods are highly processed or ultra-processed, such as refined starch, added sugar, sugary beverages, and so on and so forth.
One of my mentors, Dee Eddington, who's looked for 35 years, he said essentially, people don't choose health or not. They live in environments that make the right thing to do, the easy thing or the hard thing. And unfortunately, this is why I love Phipps so much, is they're talking about systematic environmental changes. Where people live, learn, work, and play, the environments help determine their choices. And so we have to work collectively with everybody to make sure that the environments support the easy choices and the right choices, and stop blaming the victim as much as we tend to do.